Ano ai ke aloha ya kākou. Thank you for joining us today. Today, Governor Josh Green will join the Queens Health Systems and the West Hawaii region of the Hawaii Health Systems Corporation to announce a landmark public-private partnership to expand healthcare access on Hawaii Island. In a few moments, Queens and West Hawaii region of HHSC will outline the vision and scope of the new outpatient care center and discuss how this collaboration will expand access to care for communities across Hawaii Island. Facilitated questions and answers with media will follow promptly after remarks conclude. At this time, it is my honor to welcome Governor Josh Green.
Aloha. I'm excited about today because I'm here with some of the very best people in our state who care for others. The leadership at Queens, the leadership from my home region back home, Representative Lowen, great to see you, Nicole. And a special shout out also to Representative Lowen's compadre, Drew Kanuha in the Senate. They've been fighting for something important for a long time, and that's added health care back home on the Big Island. My experience there is obviously something people are pretty familiar with. I came to Hawaii to be a doctor in that region, essentially in the southern part of the Big Island, and I, over time, gravitated north, right past where this new extraordinary facility is going to be. The people on the Big Island have wanted a new hospital for quite some time. We have exceptional healthcare providers in Kona and Hilo, all across Big Island, but we need facilities. And as my dear friend Gino and I experienced for many years in Kohala Hospital, there's a big space between where we are up in Kohala and Waimea, where Queens has an excellent facility, and then all the way to the southern part of the west side of Big Island to where Kona Hospital is now. So I'm really proud to stand with Queens folks, Jason and Clayton from HHSC, because they're doing something special with us. This is a public-private partnership that we're announcing today. It will be transformative. It will bring so much more health care to Big Island that people will immediately see a change in their lives. The west side is one of the fastest-growing parts of our state. That's the west side of Big Island, and it's been underserved for far too long. We have a difficult time attracting physicians and nurses to stay in the community for generations because, honestly, a lot of the facilities are older and it's very rural. And so this is a game changer. As you will hear in a moment, it's a forward-thinking partnership. We're expanding services and strengthening the physician and nurse practitioner and physician assistant base by doing this. Building a facility, which the state is going to put $50 million of bonds toward, building this facility for outpatient services and doctors' offices to be a companion to a new hospital that you're going to hear about from our leadership at Queens is going to be extraordinary. We'll have 50,000 square feet of outpatient care. Most health care can be delivered in that setting, but often you do need a state-of-the-art hospital right next to it because someone is going to have need for surgery. They're going to have serious emergencies that occur. So we're able to partner together to do this. This will complement the new hospital that Queens has planned and has announced, and you will hear about seamless care to be delivered. We're building a health system for everyone, and the reason I say this is because Hawaii has been the health state. We do better than any other state, but there are times when, if you're a neighbor island resident, where you really feel like you need more, and that's why this is such an extraordinary moment. So I'm particularly proud of this team for coming together. It means that there's going to be shorter wait times for our patients when they need care. It means they won't have to drive as far. It's a lot closer to the airport, where sometimes there will be transfers, but we have to stabilize patients or we have to deliver care right there. It means a lot more jobs over on the Big Island, and these are often the very best jobs in a community where a nurse is working, where an administrator or a doctor is working. There's a lot to benefit for our community that Nicole will attest to. So this is the step towards our future. It comes at a time where we're also going to have the healthcare transformation dollars for the rural healthcare system. This is going to be about $200 million per year for the next 5 years. It's been announced by the friends I have over at HHS. In this case, we're talking about Dr. Oz and Secretary Kennedy. Those monies are going to help us as we partner. So many thanks to the legislators. Nicole and I have talked about this for years, wanting a hospital that meets the needs of that part of Kona. And it just makes it so much better for our kupuna, who are going to constantly have some needs. So again, as a physician from Big Island, this has got to be one of the happiest moments I've got to announce something. And I love the team over at Queens. They are, they're fighting for people's health care along with their friends, of course, at HPH and HHSC. Everyone's fighting to deliver health care. But this facility is a new partnership, and it's a great day. Thank you, guys.
Mahalo, Governor. Next, it is my pleasure to welcome the Queens Health Systems President and CEO, Jason Chang.
Good afternoon. So I'm really excited to be here today. Governor, thank you for hosting us, and thank you for the kind words. This is really a partnership, and so it represents a proud moment for Queens because this is going to provide more care to the people of Hawaii. And that's so important to us. We made a commitment about 15 years ago when we took over the hospital up in Waimea, which is now Queens Medical Center at North Hawaii. I'm grateful to the state. I'm grateful for our partners, Clayton. Over a year ago, when I took over as CEO at Queens, we sat down and started talking about what we really wanted to do. And this conversation has gone on for decades, prior to me and prior to Clayton. And if you have two people that are aligned in their vision on what they want to create, it's so easy to work together. And so over the course of this past year, very grateful that we've been able to talk about partnership. How do we take the strengths of HHSC and Kona Community Hospital and the strengths of Queens Medical Center and the Queens Health Systems and bring them together to do something special for our community? And we are able to do that. And I'm grateful to our community friends who are here. Some of them are here with us today because they are showing the passion and interest to spread the word. The advocacy, their generosity is going to help make this happen as well. And so just tremendously grateful that we're here today making this announcement. Earlier in the year, we announced that we were building the hospital, and you were able to see some of the renderings. And some really, I think, smart, intelligent people helped us figure out what kind of services do we need on the island, and what can we do that's sustainable. And that's the most important part. And it turns out that we can create a sustainable health system, a regional health system for the Big Island. And so that's what we set out to do in partnership. This outpatient center is really the first step with the 50,000 square feet. It is intended to be a one-stop hub, and this partnership allows us to take our physicians, our specialists that we have within the Queens University Medical Group and the physicians over in the Elite Medical Group and put them in the same building and allow them to work synergistically. I think the magic that can happen when you put two outstanding groups together, combining their minds, taking care of patients in a unique way, doesn't exist. And so we'll be able to bring that to the island. And then we'll build this the hospital that Queens is building in proximity, adjacency to this outpatient clinic. And you put them all together, exactly what the governor had said, people are going to need emergency care. So we've committed to building ICUs, building an advanced emergency department, putting in advanced diagnostics, a cath lab. We have a helipad because patients that need to be transferred to the trauma center will be able to do that in the fastest possible way. So are we accelerating the ability for patients to get the kind of care that they need? Absolutely. So really, really proud that we're able to do that. And then this partnership allows us to leverage each other's strengths. And so as we think about this as being the first step, now we have a platform to build more for the future. And that's the most exciting part, because as we talk about a regional health system, it's not just a hospital and outpatient center. It's many partners in the community coming together to create the best health system you possibly can for those people. So excited with this collaboration and what it means for our patients, what it means for the state, and what it means for our communities. And so thank you. Mahalo.
Mahalo, Jason. Now please welcome HHSC West Hawaii Region CEO, Clayton McGon.
Aloha. It is my pleasure to be here today on this momentous occasion. Improving access to care in West Hawaii has been one of my top priorities, and today's partnership is a big step forward in making that a reality. For a long time, our region has struggled with many different challenges like physician shortages and limited access to care. By teaming up with the Queens Health System and the state of Hawaii, we finally have a coordinated, sustainable way to tackle these issues together. And the good news is, it's already working. Patients are feeling the impact right now. Queens surgeons have started rotating at Kona Community Hospital, giving people access to services they used to travel across the island for, or even off island. This is exactly the kind of care our community deserves close to home. The new outpatient care center is another major piece of our long-term plan. It will help us attract and keep more providers, build stronger care teams, and it will make it easier for folks to get primary and specialty care in Kona. Once fully built, it will become a hub for the services West Hawaii relies on most. We also put a lot of thought into the location. The site in Kailua Kona is central and convenient, making it much easier for residents across the region to get to their appointments. With its size and potential, it also gives us room to grow as our community grows. To keep things moving, HHSC West Hawaii Region is asking the state to support planning, design, and site prep, all the groundwork needed to build a modern medical center that truly meets the needs of our community. This partnership is historic for our region. It represents a shared commitment to strengthening healthcare in West Hawaii, not just for today, but for the generations that will come after us. Together, we're laying the foundation for a healthier, stronger, and more resilient community. I want to thank Governor Green for his strong commitment and support and advocacy to improve healthcare across the state. Thank you to Jason Chang and the Queens Health System for their amazing collaboration and focus on making the healthcare better for our community. I also want to thank our area and state legislators for their continued support and help in improving healthcare across West Hawaii. Mahalo.
Mahalo, Clayton, and his last name is McGann, not McGon. Names have power, so I wanted to just correct that. At this time, we're going to begin the media Q&A, and so I'm going to invite the governor, Clayton, and Jason up.
Before you guys dive in, I was going to mention one thing that Representative Lowen and I have discussed over the years and fought for was there was a lot of big pieces, for those on Oahu who aren't aware, a lot of big pieces of infrastructure have gone into Kona, West Hawaii over the years. We have a campus over there, which was a big deal to train more people and providers. We did a new ER down south. The county council and the county building was built. A health center was built. All these big pieces, and the road was expanded very significantly. So she and our predecessors have fought for those big projects, but this has been the one. To have a new health campus, that really, is what Nicole and I have talked about for a long time. And so it's a long time coming, and we're so grateful to have the partners in Queens, Whitney, the whole team.
Mahalo, Governor. Up first, Ashley with HPR.
Thank you so much. My question is about regarding HR 1 at the federal level, the impact on Medicaid. I'm wondering if there's been any impacts regarding potential revenue losses for both Queens and Hawaii Health Systems, and how that's going to impact, the expansion of this type of healthcare.
Sure. No, that's a great question. So if people haven't heard yet, there's a lot of pressure on Medicaid. The potential to have across the country far fewer people qualify for Medicaid based on the work requirements is significant. In Hawaii and in our community on the Big Island, for example, the payer mix has usually been about 70-30, 70% Medicare, Medicaid, and 30% private. And that's one of the challenges that we've always had. That's why it's been hard to attract healthcare providers, and why it's hard to have hospitals stay in the black. One thing to point out is the critical access hospitals like the one that Gino runs in Kohala is reimbursed dollar for dollar. Okay, so that's why we've been able to survive in the very rural setting. But we don't have that benefit in a lot of our other facilities. So this kind of partnership really will help us. They never turn anybody away in Kona. Frankly, Queens never turns anybody away for that matter either. But we can't afford to have a system where the hospital is very old and can't attract modern providers. So we are going to fight like heck to make sure every single person, there's right now 399,000 individuals in our state that are on Medicaid, continues to have that benefit. We're also worried about the potential for people dropping off of the Affordable Care Act plan. That's another immediate challenge that we have. As many as 8,000 people in our state could lose insurance. We, just so you understand, we've put $16.5 million in this coming budget to cover what's referred to as the enhanced tax credit. So if you're on the Affordable Care Act plan, we intend to keep that available to you because we want to pay for these services. All these things are tied together. We haven't seen the actual cuts yet until 2027 functionally from Medicaid, but we're trying to get out ahead of this. And that's why having an outpatient center, like our part, is often the first place that people will go. But the idea of someone having to fly for a surgery that they could have back at home and have to incur the costs of that life flight, being away from their family or home, and then maybe not being insured is terribly impactful on them. So having this new facility in our hometown of Kona in West Hawaii solves that problem. We are going to have to fight like you can't believe to keep resources in healthcare, because otherwise the potential is for billions and billions of dollars falling out of the healthcare system. That's why I think you're seeing new models where private partners come together with public partners to make it work.
Sorry, to clarify about the $16.5 million tax credit, that's currently in the budget or like for next year's budget?
Going into the next year budget, yeah. Sorry to give you that special surprise here. We just signed off on that, but that is the one significant addition to our budget, which is support for the Affordable Care Act enhanced tax credits. That will prevent 8,000 Hawaii residents from becoming uninsured. Right now, there are 24,000 people on the Affordable Care Act plan, and at least 8,000 would fall away if we don't do this. We'll be the first state, I think, to propose this. And it's possible the federal government will step up and continue to fund Obamacare for the next year or two. We've heard different messages from the administration, from the president himself. But we're going to be out ahead of that because we believe in all of our healthcare providers in our health system, but they can't do this without funding, and they can't do this without people being insured. It just doesn't really work. So that's this coming year, and meanwhile, we'll be building this incredible facility. Queens has given us land. We have the capacity to do big bonds. We're repaying the loans of doctors and nurses and social workers so that they can work in rural areas. All of this is our method to the madness, which is also what we call American healthcare.
Yeah, so I think the most important thing is that Queens for years has been the safety net for the state of Hawaii when it comes to behavioral health care, when it comes to the homeless populations. And so we are no stranger to taking care of the vulnerable people. So if somebody has Medicaid and they are going in and out, we trust our governor and his team to make sure that they fight for the rights of those people and making sure they have coverage. But in the meantime, care will not be sacrificed in the meantime. Patients still can come to our outpatient clinics, they can come to our emergency departments, they can get the procedures and the treatment that they need.
I would just add, the governor outlined it very well along with Jason. We are a safety net hospital system, and our focus is always to deliver care even when there's challenges. And like it was mentioned earlier, this outpatient care center really is the preventative piece that's been missing in West Hawaii. We do our very best with limited resources. This is going to bring more resources in, allow for us to handle patients that are complex and take that out of the inpatient setting and to an outpatient setting that's much cheaper to deliver that care versus in a hospital setting. So.
Mahalo. Next question, Michael, Aloha State Daily.
Hi. You mentioned the need for additional medical infrastructure on the Big Island in general. I know that in East Hawaii, Puna particularly, people have been calling out for better facilities, more facilities that they have access to. Are there any plans for the state for similar investments over on the east side?
Thank you. The question, if you couldn't hear, was what about Puna? Because I had that feeling. The two areas of most rapid growth are actually Puna and Kona in this case. Big Island's growing quickly. It's one of the places that's a little bit more affordable to live in the state. Not easy, but still where people can go and get a home. Yes, in Pahoa, in Puna, we are building out a facility. We put in dollars last year, and they've been matched, I believe, by Mark Benioff and his family. So you'll see an added facility in Puna. You're going to see this special facility, which will be much larger actually in Kona, because Puna has proximity to Hilo's hospital, which recently expanded quite a lot. In that case, that's the Hilo Benioff hospital. So Big Island has been in need for quite some time. We have about 250,000 of our citizens, but we often have some of the most complicated healthcare challenges where people have gone longer without healthcare. And for decades, we've been having to care for people in the moment and then transfer individuals over to Queens or to Straub for the more definitive care. We're now seeing a true healthcare system emerge on the Big Island, and it's very exciting. The community health centers have partnered in the last couple of years. They've become one entity, and that has been, I think, very positive. And now you can see this collegiality between, in this case, Queens and HHSC. A lot of healthcare, a lot of jobs, and that's going to be good in Kona.
Mahalo. Next question, Raquel, Hawaii News Now.
Now, this is an amazing partnership that you're bringing to the community. How many jobs is this bringing to the community?
I'm going to give this over to you guys. I mean, by the way, in each place, I'll preface this, like, for instance, in Hawi, where we have a relatively small hospital, those are often the best jobs, the most high-paying jobs in that very small rural community. Now look at it from the perspective of a large facility, 50,000 square feet, and then a much larger hospital. You're going to see a huge number of jobs.
So initially, we project that there'll be 350 to 450 new jobs. And I think tied to that is how do you recruit and how do you train people to occupy those jobs? This is going to be Queens' first investment in housing. So we've procured water for 150 units, which you can see if you look at the master campus up at the top part. We've tried to work with developers, and there's only so many tax credits. And what happens is you end up with housing that's not really affordable. And so we can do below market rate housing if we put the investment in. And we feel that's part of what we have to do in order to make this a great facility.
For some added perspective, there, depending on which part of where you draw the map, you might have 60 or 70,000 people living in West Hawaii. The hospitals combined already are employing 700 people. And so now you're talking about a whole new healthcare campus, which is going to be modernized and frankly quite large. So it's been a long time coming, and you can see from the proximity that it's built to be where the population has grown, and also built so that when there is still some need, if someone needs like cardiothoracic surgery or something, and they may very well come over to Queens for that, or any of the other facilities here, it'll be quick. The golden hour has to actually be a golden hour. It can't be 5 or 6 hours like we've often struggled with, when someone got sick in the rural areas.
Fantastic. Next question comes from Tiffany with Big Island Now. What is the timeline for the construction of the outpatient care facility along with the new Queens Hospital?
Yeah, so regarding the outpatient facility, we have somewhat of an accelerated timeline. First, our hope is that our legislators this session can help us get the funding. Once we have the funding secured, then we anticipate a 4-year timeline to get the building built. There's quite a bit of infrastructure that has to be built out as well. And some of those efforts that Jason could talk about are already underway. So, you wanna address?
Yep, sure. So we are in the final stages of selecting our architect. Once the architect is selected, then we start doing site planning. Our board has approved the funding of the design documents, and then we can start to break ground. But we'll plan to build these things at the same time, and the goal is to have the first patient cared for in the 5th year. So excited.
Okay, our final question, we're going back to Ashley for our final question.
Thanks. So you mentioned earlier about the Rural Transformation Fund, the $200 million. That application was due back in November. So can you give any insight as to some of the projects that are in the application for that fund?
Sure. Yes. So just to refresh people's memory, the application went in and was basically finalized about a month ago. We've had good feedback already. Every state will get a minimum of $100 million per year times 5 years. We're anticipating closer to $200 million as a state per year for 5 years, therefore $1 billion. There are 6 buckets of the dollars that go in. They range from support for the provider base, in other words, funding for places like the medical school and the programs to train providers up, so we have enough providers in the state, to quality programs, the likes that you've seen come out of Queens, for example, that's been working on quality programs for some time for better outcomes. Health information technology is always a big part of the expense for a healthcare system, and these programs will kind of defray a lot of that cost. And we're also working to make sure that we provide the social support around our healthcare system. That's another proposal that we've put in, which seems to, in general, have met with a lot of, positive feeling. So this is a time where, as was alluded to, we could see some downward pressure on reimbursements and dollars in the healthcare system in general, especially in rural areas because of Medicaid cuts. So we had to see this, kind of this amped funding through the rural healthcare transformation grants, and that's why that fight was so important to win. That was one of the more important positives that came out, in my opinion, from the president's bill. Going forward, it's going to be tough on rural communities because you will see where we are right now at 399,000 people. That's about 2 out of every 9 people or so in our state at least have been on Medicaid, have needed Medicaid support, and it's a great challenge if you see that drop, because suddenly you will not be able to sustain doctors or nurses in very rural areas like in Ocean View on the Big Island or in Waianae on Oahu. Every part of our state has rural providers, and if they leave, you leave healthcare deserts. We're doing the exact opposite here. We're creating a healthcare oasis on the Big Island, and it will attract a lot of need. People have been waiting to get healthcare services in some cases because they just didn't have the resources to travel or the time away from their jobs. Now they'll just go up the street. So we already expanded the highway there. We've expanded a lot of infrastructure, and so now with these extra dollars, this is the time to do it. I won't be surprised if the whole nation revisits our healthcare system in the coming years, even before those Medicaid cuts go into effect, because they're simply too harmful for the many millions of Americans that have no other chance at getting health care. We've been able to survive with our payer mix because a lot of people have decided to live in rural communities and continue to provide services, but we owe them a good facility, and I think that's what you're hearing today. You've had great people come together. These have been discussions that have been going on for quite some time between HHSC and Queens, and they're the right partners for this project. Okay. All right, so and I guess in closing, just thank you all. This is going to be a big healthcare year. Stay tuned for what the state's prepared to do. The $50 million from the state in capital improvement is really just a beginning. There's been a lot of talk about philanthropy, and that philanthropy should come through, I hope and expect, for Queens. But Queens' generosity is extraordinary for the Big Island, so we thank them for this work.